Well, thanks everybody. We're the last people keeping you from lunch, so we'll make this.
Got to keep the energy up.
Yeah, we'll keep it lively. But we've got a great panel here today to talk a little bit about data, audience building, privacy, analytics, and all those fun topics. So there will be a math test at the end of this. So first of all, let me just go ahead and have everybody introduce themselves, please.
Yep. So my name is Alyson S, and I work at Jellyfish. It's a global ad agency. And I have worked on a variety of verticals. My current vertical that I'm on is consumer electronics.
Hi, everyone. My name is Karima Sharif. I'm a managing director at Initiative IPG Media Brands Company. I've been in the industry a number of years, focused on pharma marketing. And I hail from Philadelphia, so you can just call me the Fresh Princess of Media.
Hi, everyone. My name is Ashley Sperling. I am a media supervisor at Syneos Health. You got to hear from Justin McGinnis a little earlier. He also is from Syneos Health as well. We handle pharmaceutical advertising.
Hi, my name is Caleb Hutchings. I'm also from an IPG agency, Media Hub. I work across the QSR space, wearable space, travel, and a few others.
Awesome, thanks everybody. So just to we've had all these little icebreakers. So the one will be, what's the most bizarre ad experience you've been targeted with? And actually, don't say it's our weekly meetings, okay?
Now, I'll kick it off. So I recently moved back to Texas, where I'm from. So I have to find all new doctors and dentists, etc., the fun stuff. So I was searching for dentists near me, doing research on different dentists, etc. And then this one dentist company, I guess, found me and kept hitting me with veneer ads. Or denture ads. And I'm like, not quite the demo.
There you
I'm trying to think. I usually search a lot around fashion or shoes, or Bravo, for the housewives. So I don't know if I have anything interesting that I remember, unfortunately.
So mine's a little bit weird. In the early stages of my career, I really thought I was going to do public relations. So I was working at a police department. We were doing a social media campaign, and it was in Manhattan, Kansas, if anyone's familiar. But we had a fake holiday called Fake St. Patrick's Day. So a lot of my searches were about green beer for a time. So I had a local company that was targeting me for green beer, which was very interesting. I'm not a beer drinker.
I have a bold one. I'm going to call out eBay. They're advertising hard on Instagram right now, and it's not related to anything that I purchase off eBay, which is typically motorcycle parts. But it was so unique because it was so specific and maybe a tad bit inappropriate, but it was a Dune-themed sex toys off eBay that's coming through Instagram. So I kept a screenshot if anyone's curious.
Our imaginations are going wild right now.
I don't know where it came from.
But you didn't save it to your phone, right? No.
It was creative.
So how can businesses, help transition? We've talked a lot about, third-party cookies and our reliance, and we're all preparing for the Armageddon or just hurry up and get it over with. How can you, transition to more first-party or zero-party data targeting?
I can jump in and answer that. Well, being in pharma, we've been already ahead of the game here, especially for HCP, or that's healthcare professional marketing. That's any marketing that's going to physicians or dentists or any of your health professionals, where first-party data has been really important to us, especially for, CRM or also, tracking them through a currency we call NPI, which is it's National Prescriber Identifier. It's almost like a physician's or a healthcare provider's, I want to say IRS number, because that's how they get paid by Medicare or Medicaid. So that's like our currency that allows us to, super target one-to-one to physicians or healthcare providers. So we've already been helping our clients kind of build that out a lot of times. Also collaborating with partners, whether it's on data, technology, content, to kind of keep focusing on those healthcare providers and that MPI, so that we can get that first party data.
I'll kind of stick on the pharma lens for a moment. When we're thinking about healthcare providers, yes, I agree with everything you were saying. But then you also have to think about the patient lens, and we can't target a patient one-to-one. We can't say John Smith, who has ADHD, and we want to target him with a very specific ADHD ad. That's not something we can do. So building out super robust audience profiles to ensure that we're reaching key demographics that we're wanting to target without necessarily breaking the patient confidentiality.
I have one that kind of sounds like a boilerplate answer, but it's been critical this year, starting with a data audit. Just going through step by step how things are tagged, how it's tracked, how it's processed, how it's stored. We work with an extremely mature brand, and once you start flipping over stones, you just realize how things are dropping here and there, how many teams you have within the organization, that you even have an international team that just decides to dabble in something that puts us out of compliance. So I would re-emphasize it more and more that you really need to know every step of that process, where it lives, because then that starts to get into the conversations with the legal teams and compliance, and lets you kind of bake out from there where your targeting goes.
Yeah, I mean, all of us can agree first-party audiences is so necessary, but it is surprising how many businesses are still working to develop a good infrastructure to have first-party data. Because it's not a flip of a switch, it is a long process, but I do agree auditing is the first step to start. And then enhancing your website and analytics and data collection. So what's tagged on the site, but also increasing customer engagement, like forms or surveys, and loyalty programs like tokenomics, Talia. Increasing that as well to be able to leverage. And then additionally, having the content that's personalized. So yes, you build and enhance your data, but having content to leverage against that data. And then the technology. So really maintaining even those big in-depth brands who have a good first-party data, but the ability to continue to manage that first-party data, so like a Salesforce, is super key.
Awesome. This just kind of keeps this conversation going a little bit, as we know the privacy issues are paramount to everybody, even more so in the last couple of years than they have been. So what are some of the tools and practices that you do to build audiences while still respecting that privacy?
Right. I would say the 4 C's, not 4 C's, I'm sorry, 3 C's that we have to really think about for privacy. And it's interesting because the last panel did hit on the Consumer Health Act, which I think Washington was the first state this year, followed by maybe 11 more states. And by 2026, we're going to have 24 more states. So that is going to be like 2/3. So that's going to be really critical for us to, especially in healthcare or anything that's adjacent, whether, vitamins or anything else, is to really focus on protecting the consumer. And that's why going to those 3 C's, we have to really make sure that we're thinking about consent first. That's very important. But then we also have to make sure we're thinking about content. I think you talked about personalization and making sure that we're personalizing the content. So when we get those, when we get consent, and that we're also providing information that's useful to our audiences. And I think the 3rd C is going to be collaboration. So how do we make sure that we're working with our data partners, our technology partners, our creative partners, to make sure that we're able to stitch together and, again, keep everything. Again, consent is the first part of it. So.
Consent and transparency.
Yes.
What you're actually going to do with that data.
Right.
Not that I read the fine print, but.
anyone else.
I think just one piece there is nothing new, but I think your measurement framework in a lot of ways starts with consent. And I think just to speak to like an example, when we first saw a lot of awareness coming around this and a lot of this regulation come into place, we saw drop-off rates. You know, it was nearly like 40, 60 of people who would opt out. And then as you built that trust behind the brand, or as you communicated some of that transparency in that moment, like more people were opting in, just understanding it would facilitate their choices, their preferences within that brand. So it's definitely helped us across the board, bringing that a little bit more forward in that transparency.
Awesome. So, is there some examples maybe you could share about using? We've talked about the first-party data. We're getting consent. We're getting insight. But how have you leveraged some of that data to actually, as an example, to build a target audience?
I can jump in on that one. So I actually have had the pleasure of working with ad media. I've worked with Emma, Kevin, I see you back there, and Andy.
She tolerates me.
Tolerates for sure. No, I'm kidding. I love you, Andy. But we actually have been able to utilize ad media and their ability to target NPIs. I know Karima was already kind of speaking a little bit about NPI targeting. When you think about paid search, which is where I specialize in, you cannot target an NPI within traditional paid search, but we can with ad media. So we've been able to utilize them on a couple of our campaigns, one of which has seen a lot of success. We had our healthcare providers spending up to 1:45 seconds on the site versus traditional search sitting around 30 to 45 seconds. So really being able to ensure that we're targeting the correct people that we're wanting to reach, and then actually reaping the benefits of having those users spend a lot more time on site and engaging.
I have one that's kind of for the inverse of it too, which is even exclusionary. We have high frequency users that we know are tried and true fans, will always be coming back to us. And when we have limited budgets, we want to spend that more to get the incremental sale that we might, not always capture. So I think there's some of that inverse that's at play. And then obviously we have a wearables client or a ring. I think I've seen a few in the audience so far. Where we use like active member lists of more engaged users in order to build a propensity behind like PMAX campaigns and things like that to send the right signals to find more users who would be apt to remain engaged with the product. So I feel like those are two kind of better examples we've had throughout the market this year.
Some examples. So I've been in the industry for a while, as I mentioned, and working on the healthcare side or the healthcare media side, again, targeting HCPs. We've been really successful when we're able to laser focus and do more omni-channel or what we call next best action. So really focusing on that journey of that healthcare provider across multiple channels, including paid and owned media. So we've seen some success when we're whether it's like ROIs, stronger CPCs, stronger CTRs. So I think the more that we're able to partner and get to that kind of one-to-one, and track that journey across the omni-channel universe, we have seen really stronger lifts in scripts and ROIs. So, which that's the currency or the goal that you're looking for.
Yep. So kind of picking back off of what you said, Caleb, for a suppression example, back on my travel vertical, we knew that the loyal customers would come back to a resort probably once every 12 months. So we made sure once a booking happened that we excluded them from our campaigns, because the likelihood is they're researching, the FAQs or how to get there or just things about the resort. So we didn't want them to click on our paid ads. And then additionally, and I believe, Brett, you were speaking to this earlier, wherever you are, is for those loyal and returning customers, and if you have them segmented by those really active, however you want to call them, members, if we have a new resort, still my travel vertical example, and we have a brand new resort, we need to get the brand awareness out, we target them specifically with that one resort to drive brand awareness for that. for that resort. So leaning in the more engaged and loyal customers.
Interesting. We've talked a lot about data and targeting and creating that one-to-one experience. But are there any strategies that you implement to ensure the privacy issue, the data privacy, the consumer privacy issues, and also so it's not in a creepy way that you're getting either left out or being targeted? Like what are some ways that you leverage to ensure you're keeping people's privacy?
Well, I mean, that's a number one issue for us because we're in pharma, so we can't even. We're very conservative, so some of the things that we do again goes back to what I talked about earlier of just having that consent, that transparency. Creating those target lists. Or customer lists, at least on the HCP side. I think on the kind of the patient or consumer side is working with partners or platforms that are being very transparent and how they're working with their different customers and partnering with them, so you're doing something in a compliant way. So I think that's where my experience comes from.
I would agree. I feel like everything you said, I would second being in the pharma industry. I would layer in that a lot of the conversations that we've been having with our analytics team is about cookie policies on websites. I'm sure if you've ever been to a pharmaceutical website, you've seen the giant opt-in or opt-out screens. And then also having the ability to opt in and out of email streams as well.
I feel like your question has kind of two parts of it in the way that I see it. One is the stewardship part, is how do you maintain it and how do you make sure that it's staying that way? And then the other part is how do you make the customer feel that it's transparent and they're open to that tracking? On the first side of it, so on the agency side, we work with the client, their privacy counsel within their side, their analytics team within their side, and then the marketing team. So there's 3 separate groups that we are trying to educate as we're learning ourselves exactly how Google exactly is processing things. They even need to know the specific hashing code in order to understand how it's being processed so that legal can understand the language and run that through. So that's been a major challenge this year because we had to plant the seed really early on just to get to the process of this year to get buy-in from legal to move forward. And that revolves around conversations about enhanced conversion tracking and some of that conversion measurement. But sometimes legal teams just want to shut that down immediately because they don't understand all the ins and outs. And then we work them back to the table through that education.
Yeah. And I would say that goes back to collaboration. You do really have to collaborate with your clients across the different stakeholders and across different channels that you want to put into the marketplace. So if we're thinking about search and anything from a paid media perspective, we're also thinking about other platforms, whether it's social media or other digital experiences. So it's making sure that you are collaborating across those different stakeholders because it's multiple stories and multiple conversations that you have to get things approved. And when we think about healthcare marketing.
Awesome. We talked a little. This lead into the last question. We've talked a lot about data and analytics, and AI's come up a couple of times today. So, how are you leveraging any AI tools or reporting tools from a data analytics standpoint to help you be more efficient?
Yeah, I can kick that one off. So agencies love their proprietary tools, but our agency created a specific reporting dashboard that leverages AI, and it's able to pull data from multiple sources across multiple channels, and it provides it in a dashboard that gives you real-time data. So you can quickly identify trends. It sets it up visually as well. And that enables us to save time by pulling data more manually and also more siloed. So just ultimately providing a more effective way to get insights for our clients. And then also the other side to that is it saves us time by pulling that data to be more strategic. So reporting is a big one for us.
Yeah, I would agree. I think stitching together a lot of the data sources is where AI comes into play. Also, from a content perspective, like we're utilizing a lot of AI in dynamic content optimizations now. You see it across different platforms or different media channels, but even from a for instance, like emails that we may want to send to, our target list of physicians, how we could easily change the look and feel of that content, change the patient out from, a black man for like cardiology, something for cardiology versus having even Spanish language, show up. So it's really important. It's been really important for us to have AI to help us get to the next level and how we want to communicate across, again, creative content as well as stitching together the data sources that we're seeing across different platforms.
I'll layer into the content piece as well. A lot of what we're using AI for is understanding the ad content that we're putting out. Is cost language more efficient and getting engagement from our users, or is savings language more efficient? So really being able to very quickly understand how we need to pivot in the marketplace to best appease our audience and ensure that we're getting the engagement that we're wanting to see.
I would actually tie a part back to the onboarding conversation from an earlier panel where a lot gets promised in those pitches, and our poor agency analytics teams have to build it out after that and end up getting strapped for time. And I think this is a perfect application where it can streamline their operations across like multiple data sets, finding original trends to dive deeper into off of like quick analysis. We do have tools that analyze auction insights where we come into it with a prompt that has a thesis that we've seen, rising competition from certain competitors. And that can quickly get us to an answer to or a metric to dive deeper into. So that's been super helpful. And then also from clients, we get a lot of forecasting requests for analysis of what we expect, or next best decisioning that was kind of mentioned earlier to model out where we expect it to go. And AI helps facilitate that across analytics teams.
Yeah, and one thing I'll add too, at least from an effective way to leverage first-party data, goes back to what you just said. What message is actually resonating more with the customer? The importance of A/B testing. So ideally, perfect world, yeah, it makes more sense to use that language for these sets of customers, but you really don't know unless you're A/B testing. And then you can use AI to help with that reporting and analysis too.
Awesome. Thanks. I think we've got a couple minutes for questions. Does anybody have any questions?
Making you work.
Okay, so if you've got a question, please raise your hand and say, start with your name and the company that you're with. So,
Hope no one's here from eBay.
yay. So, Brooke, BB Clark and Myler. So, I guess my question is in terms of measurement. Using data, using testing as you described. One of the things that, I've seen is really important is incrementality testing, but I think proving it out is pretty difficult. So how have you guys used data or observed the trend of data in your day-to-day in terms of proving out some of that impact?
Well, I would say we do a lot on a test and learn side of things, especially when we're trying to find new audiences or have new partnerships. Some of the projects I worked on most recently is around getting data in real time, but in pharma, real time is probably like a week behind where we're getting a lot of data, the engagement data from our partners to see are we moving the needle with, a physician or a writer versus a non-writer, and did they engage with our asset or with our program. And so by the next week, we're able to say, okay, they did engage, let's put them on the next track of the journey. Or if they didn't engage, do we need to create more frequency? So that's how we've been looking at the data, at least from my experience, where we're trying to find those nuggets to see if those audiences are engaging with our content, with our programs, and then moving them across the journey.
Yeah, the incrementality piece is sometimes a challenge to actually figure out, but GeoLift studies I know is a good way, but also we have been using GA4 for some of our clients who leverage GA4 to see what channels are actually driving lift by looking at it holistically. That's a kind of a broad answer, but a couple ways.
All right. Hi, it's Vildan again from Henkel. Very interesting discussion. Thank you very much. I actually want to ask to Alyson, but it might be to all of you. You mentioned about the A/B testing and to just validate the message to the target group. Well, obviously we have many target groups, right? And how can the data-driven marketing, with different assets, with different messaging, could be tested? Is it an ABCD testing, or with the AI there are other different methods? I mean, feel free to also step in, because I think this topic is evolving. I want to understand how it's basically in your areas. Thank you.
That's a great question. We don't necessarily default to ABCD. We like to have that control group. So whatever that control messaging is, and then testing it against the testing messaging. And we want that testing to be specific rather than multiple testing variations within that. But to your point, now that we have more ability with AI reporting, that could be changing. But for us, we're still the traditional A/B testing. You have your control and your variant.
I think also that's where AI is coming in, where it is kind of doing it all at once, where you're kind of in the moment testing multiple assets at the same time it's optimizing to what is performing. Obviously, we talk about the different audience segments where you're getting more specific, but I do think that's a better consolidation of efforts and getting us to an answer faster too, like in the moment. Is particularly behind app campaigns, and a lot in that space is working pretty efficiently.
Yeah, and I would say KPIs are super important with that, because you want to have your KPI identified before the testing, and it might vary between what you're testing, of course, but having that measurement in place going into it, rather than looking at everything and it gets overwhelming and lost in the sauce, as some say. But yeah, having your KPI is really important.
All right, cool. Anybody else?
Oh, another question.
Over here.
Yeah, okay.
How's it going? Brian from Ariat. So I've heard a lot of talk about propensity modeling and kind of trying to categorize consumers by like their loyalty. In what ways do you leverage these categories in data, and how are you able to effectively, like, how does the messaging shift as one person passes from one group to the next?
I can kick it off from this end. I think in the QSR space behind Chipotle, I think they're pretty advanced in that, and it comes down to their loyalty programming. So there aren't really buckets of rewards that you kind of just like they send out to people. Like, it's actually catered very specifically, and the points can even like vary based on the users and how it varies. So I do think they've done a lot of work to identify like like segments of their audience that do add a lot more value. There's everything from within kind of the high to low frequency, they've built out more buckets beyond that around like personas, essentially, and knowing what value they add to the business. And I think that develops kind of how they're catering that messaging, but also the incentives behind that loyalty, how they're sending them out to those different users in those segments.
Yeah, I would say understanding your audience, especially when we're thinking about those different segments. So, and when we're thinking about physician marketing, you have some physicians that may be already writing that prescription for that cardiology drug, and then you may have a segment of physicians that are not. So it's easy for us to kind of look at those two different segments, understand what are their, what type of information is relevant for them, who's their patient population, and then really partner with like the creative agency, or a lot of times our media partners, to just figure out what type of information can we give them to to get them to write that prescription. So sometimes it's a long journey from like awareness to writing, but that's how we can look at those two different segments and help them across the journey to get them to write the prescriptions.
And then I would also layer in that when you think about like a patient journey, right? We're not targeting John Smith who just got diagnosed with ADHD, but we are targeting someone who is looking for what is ADHD. I just got diagnosed. So really having messaging that's speaking towards, hi, I understand you just got diagnosed. Here's some information about ADHD versus someone who is already on treatment, who then you can say, hi, I know you're on treatment. Here is a page specific for resources and support for X brand that you might be on.
Right, cool. We have time for probably 2 more. Oh, come on.
Smart group. Everybody wants to get to lunch.
Yeah. Going once, going twice.
Okay, we're good? All right. Okay, Andy, I'm going to bring the mic back to you.
All right. Thank you.
Thank you.